Everybody's asking me to be louder. I'm just trying to figure that out. Dr. Mehrotra, can you hear me?
I can hear you very well, Ankur.
Okay, perfect. So if there is any issues, it could be on your net side. That's why I was just double checking. Give me another minute and then we'll start. All right, perfect. So we are live now, and it's a pleasure. I will repeat the rules again. Sorry to be repeating again and again. I am trying to be loud enough. The rules are simple. We will be having a Q&A session with Dr. Mehrotra. I will be asking him some questions. I'm sure a lot of the viewers will be having a lot of questions. The only thing they have to do it is either be on the chat box and ask all the questions, or they can ask the questions on Facebook Live, which is about a minute delayed. So you will ask anytime on that and you will be getting all your questions answered. I will be monitoring all those questions and asking him. Welcome, Dr. Mehrotra. Thank you for being here. It's Sunday early morning there, so thank you for taking that time out. We're all excited to hear you. I know this time during COVID-19, I'm a parent of a 6-year-old. It's a very difficult time to be a parent because you need to figure out how do you keep your kid entertained and productive at the same time at home, and all the anxieties and worries they could have, including the parents themselves. So it's a very difficult area, and I'm sure you will cover those areas in your talk today. Ashiana and my whole child center of GK2, which Dr. Mehrotra and my wife run, brings this webinar to all of you. Dr. Mehrotra is actually a pediatrician out of the US in New Jersey. He is a faculty member and assistant chair of the pediatric division of Robert Wood Johnson Hospital, as well as JFK Medical Hospital out of New Jersey. He runs 4 centers, pediatric centers out of there, and 1 out of India, and has two trusts, one in India, one in the US, which helps kids with special needs. So I can keep talking about his achievements, but what I love about him, and actually my daughter was born in the US and he was the pediatrician at the time. And, being first baby of ours, we were very worried, had lots and lots of questions. And he used to be very patient and spend hours with us answering our questions, making us comfortable. And what I love about him as a doctor is he doesn't use jargons and keeps it very simple. That makes life a lot more easier. So thank you, Dr. Mehrotra, to join us. We're excited to have you here. Can you say a few words about what you're going to be talking about, and then I can start with questions.
Sure. Thank you, Ankur. This is great to be here and talking to the audience across. It's an honor and a privilege for me to be able to discuss a few of these things that are on everybody's minds these days. We are engulfed in this terrible pandemic, and we've lost a lot of loved ones, friends, family members, healthcare workers, and it is a devastating time for a lot of people. And I'm sure that our kids are sitting scared, a lot of them, because they just don't understand what's going on. And I know they've been sort of put aside into their homes, locked up there, and they may not understand exactly what's going on. And I'm hoping that with this session, that parents can at least try to understand a little bit more, and hope that they can converse better with the kids and allay some of their fears. So thank you very much for having me on here. So just to get into, and I'm sure everybody has heard enough, but just to recap and summarize exactly what's going on with COVID-19. And, we hear the word COVID-19, but COVID-19, the full form, is really the coronavirus disease that was discovered in 2019. And that's where the name COVID-19 comes from. It's a virus that has been around for centuries, but this is a novel virus that has mutated and now started to cause this devastating illness. I know when I was training, we used to really bypass what was, about coronavirus. We would have a list of viruses that we were learning about in medical school. And it was like, okay, coronavirus causes a cough and a cold, and that's it. But now this virus is really quite devastating. So I just to go over a little bit of the rules here as well, and a little bit of this technical stuff. I am seeing some visuals that pop up, some doodling that people are doing. So I'm not sure if that's something that needs to be controlled. And can everybody hear properly? That's one of the questions I have for you guys as first. Ankur, are you able to hear me?
To me, Doc, you're very clear. So I think
Okay.
there are a few people and few of them are clear. So it seems some kind of a problem at their end, and I'm not sure how well we can help that out.
Oh, okay. Okay, then that's fine. So that's, I think
only suggestion for them could be that switch to Facebook. It might be helpful there. If you can't hear us on Zoom, I might be able to switch it to Facebook. Might be more comfortable.
Okay. Okay. So we've been hearing numbers of cases that are out in the world, cases that are local to our community, cases that are in our neighborhood. We hear about cases that are dying and cases that are severe. So what do all of these numbers really mean? And have we really looked at the numbers in children? So when we look at the numbers in children, the largest study that has come out is from China, which was over 2,000 pediatric cases that they had. And the way they described it is, the distribution. About 50% of those kids really had mild symptoms, and about 40% had moderate symptoms. About 5% really had severe symptoms. So it was not, it's not, something that has been very critical in kids. And that's why I think a lot of people have not looked at it in so much detail or paid attention to a lot of the kids, because they're so worried about trying to maintain lives and maintain sanity in the adults, that the kids a lot of times get pushed out to the side, which is fine, because right now I think our main goal is to make everybody survive as much as we possibly can, try to find the best cure, try to find the best way of testing, try to find the best way to control the disease. So, the prevalence, as I said, most of them will do fine, will be either asymptomatic or with mild symptoms, and they'll overcome it. And you may not even know that they had it. So there have been, some case reports out there about deaths that have happened, and people have said that they're attributable to corona. So when they did the testing came out positive, but still it's unclear if the disease, if it caused the death because of coronavirus, or it was what was called an incidental finding. So we don't know if that, because of some underlying issue that the kids had, something in their immune system that didn't tackle the virus properly, or some other issue that caused the child's death, but the child was also a asymptomatic carrier. So we have a disease where the kids can be carriers, and then they can go ahead and transmit the virus to other people that they come in contact with. So a lot of our families that live as joint families have older seniors at home, have grandparents, older aunts and uncles that are living around that they interact with. So if you're asymptomatic, you have the virus, and then when you go and meet with them, you sneeze or you cough on them, the virus gets transmitted to the adult, to the senior, and that senior then can have devastating results. And that senior could possibly die from coronavirus. So that is why it is extremely critical that even though the kids are these silent partners in the disease, they're sitting there quietly, but they are one of the most critical pieces in the transmission that can happen with these kids, with the virus and the disease. So, the whole thing about social distancing, the whole thing about closing down schools, the whole thing about trying to isolate everybody, the thing was that to make sure that the transmission doesn't happen from the kids to somebody else that can have devastating results. So I hope that is a little bit clearer on why kids needs to be, the role of the kids needs to be addressed. So as you know, we've heard enough about good hand washing techniques. We've heard about social distancing. So a lot of that I'm not really going to get into, but we know that the numbers are large and that it can potentially cause bad transmission rates.
Doc, can I ask you this question about washing hands? How often should we wash our hands? It's a very difficult area. You'd never know when to or when not to wash your hands. So what's the rule we should follow?
So I think if you're touching anything after that, you can go ahead and wash your hands. The main thing is you want to wash your hands definitely before your hands touch your mouth or your nose, or if your hands are touching somebody else. So make sure you go ahead and do that, because you want to, if there are virus particles that are on your hands that are being transmitted to somebody else, the mode of transmission is through what we call the oropharynx or the nasopharynx. So anything up here is what's going to go ahead and transmit the virus into the body. So you want to wash your hands, make sure you get the virus off the hands, so that accidentally when you scratch your nose or when you touch your mouth, the virus does not get into your system. And same thing, you go to your grandparents and you go ahead and touch them by mistake, the virus then gets into them.
So now I'm not living in a joint family, but I always wonder, if you're in a joint family kind of a situation, what should be, because if you said it's not, with kids, you'll not even see the symptoms and they may be carriers of it. So, at what situation should we worry, and what are the kind of rules or regulations we should have with kids and the elders around, so that we are very careful passing anything out?
So we know that we love our family members. We know that we love our grandparents. The most important thing is to keep your distance from them. And I know kids love to go ahead and run, especially if you're toddler age, you'll go running to your grandparents, you'll get hugged by them. Try to minimize that as much as you possibly can. Especially if you've been outside, you want to make sure that as soon as you come inside the house, you change your clothes, you wash yourself, you take a shower, whatever you can to get rid of all of the germs that are on your body before you touch anybody else. So if I'm going out of my house to go to the hospital or to go to my clinic, I make sure the first thing I do, as soon as I come back, is I don't say anything to anybody. I go and change my clothes. I go ahead and wash myself. I go ahead and take a shower. I have my mom that lives with me. I have my daughter that lives with me. So I try to keep my distance with all of them. So we go ahead, and if we're sitting at the dinner table, she's sitting about 2 chairs away. I'm sitting 2 chairs away. So wherever you can socially distance yourself, even though it may feel bad at this point, you want to go ahead and do that. And wash your hands as much as you possibly can.
Okay, there's some people who are raising their hands, so I just request we're not taking up questions on the voice side. If you're raising your hands, just write your question onto the chat box, and we will ask Dr. Mehrotra that question. One more thing, as a parent now, what conversation should we have with our kids on coronavirus, especially in that 2 to 7, 8 range? They understand it, not understand it, how much should they understand it, and what is there for them?
So the kids in that age range, they'll have some understanding. They are probably, they're at home, but they don't understand why are they at home. So if your toddler was going to a crib where they were being, dropped off in the morning and coming back in the evening, or your kid was going to school on a daily basis, to them, this is a change in routine. And we need to explain to them that this is a change in routine because there are some germs outside that can cause harm to your body or to somebody else's body. So we want to keep you protected. We want to keep you inside the house. And that is why you are at home. This is not a vacation time. And I think a lot of kids are enjoying themselves because they have the family all around. They have the parents all around 24/7. This is a time that they've never had before, right? So you can go ahead and enjoy the family time, but also let them know that this is only a temporary phase. And as soon as things normalize, and as soon as these bad germs go away, we will be going back to our routine. And then see what sort of response what sort of questions they have. And we'll get into some of that a little bit more down the line. I know that people have a lot of questions about anxiety and sleep and so on, but these are some of the few things that I would tackle initially, is to explain to the kids, why are they at home?
I believe there's a nice story which WHO has come out on this particular thing to explain to kids. And there's a book which has been written, so it could be an interesting thing to read to your kid. I did that, and it was helpful for her to understand the same. One more question. Is there a way to build immunity around it for kids, for adults? What can we do? And how much does lung play a role on the same?
So I know this is a question that all parents have, even outside of Corona times. This was one of the most common questions. Every time a kid would get a cold or a cough, a parent would ask, hey, doc, can you tell me how to boost my immunity? So there is no magic pill. These are what we call lifestyle habits that you need to develop to have a good immune system. Starting from when the child is first born, you want to make sure that the mom breastfeeds, because that is how she's going to pass on the immunity to the kid. Okay, so if you're beyond that stage, you want to make sure that the child has good hygiene, good hand washing techniques. So they're taking showers, they're well groomed. They learn about, washing their hands before they go to eat. They wash their hands after coming to the bathroom, after coming out of the bathroom. So some basic hygiene skills, which I'm sure that all of our viewers probably know, but just once again, reminding kids that this is what they need to do. A lot of, parents with kids I hear nowadays, oh, we don't take a shower in the morning because we're at home anyway. No, go ahead and make sure you take that shower the timing that you normally would have taken. You want to keep those habits going. Next, as the child is growing up, you want to make sure that the child is getting their proper immunizations to make sure that they're protected from the major illnesses that we have had over the years, over the centuries. Right now, the immunization schedule is a little bit off, so we'll get into that a little bit more as well. Next, you want to make sure the child is eating a nutritional meal, is eating, all the major food groups, the dairy products, the proteins, the fruits and vegetables in a balanced way on a daily basis. So it's not that they're constantly going out to have quote unquote junk food, which had become sort of the norm. And the good thing, the silver lining you can look at maybe in this situation is that we've stopped going out, we're cooking much more at home so that the food is much more healthy and nutritious. And then finally, a really good sleep cycle, making sure that the kids are sleeping when they need to sleep and that they are getting enough sleep. So if we break it down into the age group, preschoolers, they should be sleeping at least about 10 to 12 hours a day. Children that are in the school age going child, 6 to 13, they should be sleeping between 9 and 11 hours. And adolescents, usually about 8 to 10 hours. And we as adults should be getting about at least 7 to 8 hours. So if we can maintain a good sleep cycle, we can maintain good nutritious meals, we can make sure that we have good hygiene, and then we make sure that as we were growing up as infants, we had breastfed, and also we have good hygiene and hand washing techniques. All of these are going to go ahead and give you a very good immune response. So there are kids who have poor immune systems, but those are kids that we deal with on a day-to-day basis. But for a general, healthy, otherwise normal kid, these are the things if you follow, you will have a good immune system. There are a lot of these quote unquote things that are sold on the market as nutritionist supplements. They'll boost your immunity. You take vitamin C, vitamin D, zinc, you take certain protein drinks. No, you don't need to do all of that. If you're eating well and you've followed all these other steps that I've discussed, you will have a good immune system.
Thanks. Two things. Washing hands. I used to, when I was a kid, think washing hands is just putting soap and just washing the hand. And lately, there's lots of videos going on. And I know you taught my daughter how to wash her hand. So can you later, after the presentation, can you just give some video on the Facebook which people can see to wash their hand? That would be great. On the sleep cycle bit, I had a question. We would like our kids to sleep, but sometimes anxiety or they saw something which makes them fearful. They're not getting sleep. What can we do during that time if your kid is not sleeping in the night?
So the most important thing for the kid to know is that you are there, that they're secure. They're anxious because they're not sure what's going on. Nobody has really explained it to them. So giving them that comfort, making sure that they understand that things are going to normalize over time, that you as their protector, as their parent, are there for anything and everything that they need, is the most important way that you can reduce that anxiety. Kids will continue to go ahead and have that anxiety, especially if you're constantly listening to the news, you're constantly looking at those WhatsApp forwards and so on. Those are instilling fear. I mean, yes, it's great to be informed, but also you need to limit how much you're watching, how much how much exposure your child is getting, because that is constantly on their mind. Because, oh my God, my parents are constantly worried about Corona. Oh my God, something is going to go wrong. Oh my God, then something is going to go wrong to me as a child. So you want to make sure that there's a balance, and you want to make sure you give them a lot of love. You want to make sure that you tell them that you are there and things are going to be okay. And it is extremely important to keep on reminding that things will be okay.
Thanks, Dr. Mehrotra. And I was reading this book, and they said, the child should feel that home is a safe place and the parents are the safety net they have. And I think that's very important. We'll move to this question of immunization. And I'm seeing in the chat box also a couple of questions. Somebody who has, I think, a 9-week old baby, should they go for immunization right now? Is it the right time to go for it? And can you just elaborate a little bit on that area?
So and this is, I think, a much larger discussion. So let me just go ahead and preface this by, first, how do you even approach your doctor, right? How is the whole system changed at this point? Even if your kid gets a little sick, you need to be able to contact your physician. So your physicians, most of them are, at least in the US, and I'm not sure, I cannot speak for India, but we are doing what's called telemedicine. So parents can get on the audiovisual conferencing and show their child to the physician. They can talk to the child, to the doctor on this apparatus. It could be Zoom, it could be WhatsApp video calls, FaceTime, anything like that, where they can get firsthand advice. So most of the physicians, we are keeping all of our sick patients out of the office. So we're not letting them come into the clinic, and we are dealing with that on the video conferencing. Now, the kids that are needing immunizations, we go ahead and set up a very separate time where they can come in and get the immunizations. So the mornings might be the time where the immunizations are given to little babies. So we'll have them for maybe 2 or 3 hours, maybe 2 or 3 days a week. And when the child comes in, when the infant comes in, we try to minimize waiting time. So the parents will wait with the child outside in their car or somewhere else. Or if they're coming in, we take them directly into the room and deal with all of the intake in the room itself, so that there is no exposure for the family or the infants. The recommendation by the WHO, the IAP, is to go ahead and get those vaccines, the major vaccines for the babies up to 6 months of age or even up to 18 months of age, as quickly as possible, where you have connection with your doctor, that you're sure that they can see you at a time to get those vaccines. You go in totally protected, you get the vaccines, and you come right back home. Because the things that we're also worried about is we have controlled a lot of these childhood illnesses with the immunizations. And if we stop giving these immunizations, these illnesses might resurface again. And we have seen that, especially in the case of measles, where when a lot of parents stopped giving the measles vaccines, or if the measles vaccine was delayed, then there was an upsurge of the epidemic in measles. So we want the parents to go ahead and get the vaccines, but if their physician doesn't allow, if they don't have the means to go in a protected manner, they can go ahead and postpone the vaccines for a couple of weeks. But I would try to get the vaccines as quickly as possible. There are timelines where the vaccines are given, but in this situation where everything that is happening around us is not normal, we'll have to adapt and see how things go.
There are lots of questions coming. I would like to take that up, but let me just ask two quick questions and then we'll get to those questions. One, when should, if a kid is sick, at what stage should we take them to a doctor or hospital? At, well, you know, it's not corona, it's just regular sickness, a stomach ache, a headache, a fever. At what stage do we take that kid to a hospital or a doctor?
So, and I'm sure a lot of our parents already know. So corona can present in many different ways. It does not have to be just cough and fever, which is what we are hearing about. You can have GI symptoms, you can have nausea, you can have loss of taste and smell, you can have diarrhea, you can have fever. So anytime you have a symptom that you're unsure of, the first thing you need to do is to contact your physician, your pediatrician, and ask them what they think. So when the pediatrician is able to visualize the child, is able to get a full story of what is happening, they will guide you. At this time is not the time to go ahead and take a child to the hospital unless if it is a life-threatening emergency where the child has stopped breathing or something along those lines. So any sort of an ailment that you're not sure of and the child is stable, first step is to contact your physician and ask them what to do next. So for me, if a child comes in with a fever and a cough or a cold, I will go ahead and visualize them on my video conferencing. I will go ahead and see, get a full history. How long has the child had the symptoms? What have they been exposed to? And what the child looks like. We can tell a lot by looking at the child. And then we'll tell you what needs to get done. And if the child still doesn't get better, then you can keep on in contact with your physician and get the proper guidance. But do not at this time take your child out because you don't know what they will be dealing with. And as it is, I know in the US, the hospital system is so overwhelmed that we're not even entertaining bringing any kid in there unless it's a life-threatening emergency.
Thanks. And one more question, which I think a lot of people would be asking, is the idea of screen time during these lockdowns. What's good screen time? What's not? How do we schedule our kids? What is the good schedule like?
Okay, so this is something that's going to vary from parent to parent and household to household. But what we need to do is to try to maintain a schedule like we had before. So just because everybody's at home does not mean it's vacation time. It doesn't mean that you can just sit there on TV and Netflix and all of these screen time things and just be there all day long. No, you need to have the routine. So you can go ahead, if your child is supposed to go to school at 8:30, 9 o'clock, you go ahead and make sure the child is ready by 9 o'clock and have them sit down in their corner of the room, wherever it needs to be, that they are now to partake in their school activities. A lot of the schools have been giving online activities, so you will not count that towards your media. The kid will go ahead and finish their school activities. They will take their lunch break like they normally would, and then get back to their school activities. Now, once they're done with their school activities, if it's 3 o'clock, they're done. They have their couple of hours to do any other activities that the school might have assigned. And then after that becomes a recreation time. It can be 1 hour, 2 hours, but try to limit and maximize the human interaction that you can give to the child. So don't let them just be on there as a babysitter because you need to do some other work. This is the time where they need to connect with other people and use their time constructively. So maintain your school schedule, maintain your activity schedule. Whatever at that time after that, they can have their social interaction with their friends online. And then if they need some more recreation time, 1 or 2 hours of watching movie or TV, they can go ahead and do that. There is no exact number of hours, but wherever you can minimize the media time, go ahead and do that.
And I think that was fantastic. I think setting up a schedule like it's a normal day in your life makes the child feel a lot more comfortable, and something we have been following, and it's been helping a lot. So I'll take up the first question. Mrs. Khanna asked this question. My question is can we take our 5-year-old son outside for a walk?
You can go ahead and take your child outside for a walk. Make sure that you go ahead and cover your faces with a mask. And wherever you're going around for a walk, you have a social distancing of a minimum of 6 feet. So you're not sitting there and socializing with other people. But if you have to socialize and you run into your neighbors, you go ahead and keep your distance and talk at a distance. But wherever you can stay home, you go ahead and stay home. If you're outside, stay covered.
In that, I just want to add, India rules are different. So if you're living in any of our housing projects, you will have to follow the laws of India and make sure, because it's not one kid bringing. If everybody starts bringing the kid, then the social distancing becomes an issue. So just be careful with that.
Yeah. So I apologize. I'm thinking of US standards. So thanks for correcting me on that.
Fair. So somebody has a premature baby and it's 9 months old. So saying what kind of precautions do we need to take for somebody who's premature at this time?
So same sort of precautions that you would take with any other child. The premature child is at much more risk of developing other illnesses. So you want to minimize contact with anybody else as much as you can. Keep that child home and make sure there's good hygiene and hand washing wherever possible.
Great. Somebody has a 5-month-old, and this is not, I don't think it's a COVID-19 related question. And he said, when should the kid have full head control?
Full head control can come in anywhere between 5 months onwards. We start to see that around 3 months. So depending on what they're defining as full head control.
Doc, we can't hear you.
Can you hear me? Can you hear me now?
Sorry, some technological issue. We can't hear you. Yeah, that's much better.
Okay.
We can hear you now.
So the thing was that the child should start to develop head control around 2 to 3 months of age when they're lifting up their head, and it starts to solidify by about 5 to 6 months is when we normally see. So it depends on what exactly they're defining as full head control, but that's when we should between 3 to 6, 5 to 6 months is when we would see it.
Great. Ankita is asking, she have for 3 to 8-year-olds, what are the special fruits or vegetables right now for good immunity we should be making sure the kids are having?
So good fruits would be oranges, tangerines. I mean, they'll give you vitamin C. There is some discussion about vitamin C boosting immunity. So definitely they can have that. They can have other apples, and any variety of fruits would be good for the child. Any sort of berries will have antioxidant properties. So each fruit brings in a different property. So if they can have a variety of fruits, and once again, that's limited by what is available right now in their environment.
Great. Aditya Tulsian is asking, my child still has to take her vaccination. We're already delayed by almost 45 days now. Should we go ahead with the vaccination once the lockdown opens up? As we were told, vaccines reduce the immunity for a short period.
No, that is not correct. They should go ahead and resume their vaccines right away. And vaccines will actually boost the immune response for that illness. So you need to protect your child from other illnesses that they are predisposed to. So make sure you get the vaccines as quickly as possible, as soon as the lockdown opens up. So actually, let me go back and say that also when I told parents that they can go into the physician's office for the immunizations, I guess in India, if it's a lockdown and they're not allowed to even do that, I'm not sure. I'm sorry.
No, that is allowed. So we should
allowed.
get immunization. So that I don't. Doctors are considered unnecessary services. There is another question on, any vegetables or food. You've kind of answered that. If you want to add anything on it, on that, I think you've answered.
Uh, I think at this point also it's about adding a variety of fruits and vegetables, whatever you can get. And there are other factors that come into how can you actually get the child to make sure they like the food and they're willing to try it. A lot of parents have a challenge where the child may not be willing to try it. So you'll have to work out all of those details. Get a variety. Carrots will bring in different things. Apples will bring in different things. So it's a very broad question here. But get a variety of fruits and vegetables.
Let me ask you a question the other way around. What should they avoid? Like, clearly not. Is there anything we should be avoiding?
In terms of fruits and vegetables, no.
My son is 3.5 years old. He is getting cough in every 1 or 2 months from last 1 year and lasts for 7 to 8 days. And now he's having wheezing sound in breath after coughing at night sometimes. How can we cure this, or is it normal?
This is not normal. What it is sounds like it's probably some sort of allergies. It could be pollution related. It sounds like it could be allergy induced asthma if the child is getting wheezing. Not an uncommon problem with kids. So, definitely working this out with your physician in terms of, does the child need some sort of allergy testing? Does the child need to have some preventive medications to make sure that they don't keep on wheezing? So this is something that is you need to follow up with your pediatrician to make sure that they're getting the right guidance and getting the right testing done.
Babita and Madhu are asking, is there any medicine or any kind of vaccination right now in this current scenario we should get the kids?
Right now, that is the race to try to get a vaccine against corona, but there is nothing that is available right now. They're saying that it could take at least another year and a half before a vaccine is available. And that is what everybody is praying for, that as soon as that vaccine is available, hopefully we'll be able to control this in a much, much, much better way.
Any vitamins and minerals which children as well as adults should take?
So there's a lot of stuff out there on the media, on the social media about different vitamin supplements. But once again, there is nothing that has been proven scientifically that it's going to boost your immunity or not. So the most important thing is to having a balanced meal, eating nutritionally all of the food groups. I'm sure people will ask about vitamin C and vitamin D and zinc. These are the things that have been circulating out on social media, but there is no scientific background for that, and there is no recommendation of taking a supplement with a certain milligram factor that will improve your immune system.
Okay. Interesting question. As kids are home minus 3 years of age, they have become too restless and agitated as no outdoor activities. They don't want to sit for Zoom sessions or schools either. What can we do about it?
This is a common problem for a lot of kids and a lot of parents that are dealing with it, especially if they're special needs kids. I know at our center in Delhi, we've been trying to offer teletherapy services, especially for our special needs kids who have ADHD or any other chronic illness. It is extremely difficult to maintain that focus on a child, and they do get bored because they have short attention spans. One thing that may work for them is to break down the sessions. So if it's a 45-minute session, see if you can break it down for 15 minutes, give them a break, have them come back again. Have a variety of different activities that the child can do, giving them that attention span for 15-20 minutes, letting them go on to a different activity, and then bringing them back in. But whatever you try and whatever you do, make sure it is still structured so that the child understands that this is not a free play time, that this is not a time where they can go ahead and be on vacation. This is still the learning environment for them. And if it's a structured learning time, that is the time that they need to be on.
Great. Thanks. I'm sure it's going to be a huge challenge. I've been hearing some videos where I was thinking of teenagers who about to go to college. That was their last year, and they were going through a lot of anxiety. So this is tough times, and we need to figure out how do we create safety and make sure we create very challenging.
That is a true scenario for a lot of kids, and it's for any kid who is graduating, right? So these are kids who are graduating from high school. These are kids who are graduating from college. These are kids who are graduating from middle school to, they're missing out on their graduation ceremonies. They're missing out on meeting their friends for the last time. They're missing out on all of the activities that may have been planned at the year end. It's unfortunate, but it is the need of the hour. So they have to go ahead and comply with it, and hope that if you as a parent should be able to sense when your child is getting really anxious. You should be able to understand when your child is running into a problem. Make sure you coach them through it. You have to go ahead and have that communication with your child to let them know that things will normalize and this is okay. If this is not happening, then we'll go ahead and do it at a later time. So there are many things that have been canceled. And as you know, my son's wedding had to be postponed, had to be canceled as well, because it was right now. So
I know, 3 weeks from now, right? Oh no, 4 weeks, yeah.
Right. So wedding got canceled because of the corona. My daughter's graduation has been canceled. So there's a lot of things that are happening, but we have to take it as it comes.
So another question on the same thing. 9-year-old has cough and cold in the night daily. Suggest what we can do.
So I can give you some general guidelines, but if there is something more concrete, I don't want you to take this as total medical advice, and make sure you interact with your pediatrician on this. A lot of times the kids will have postnasal drip, will have some mucus that has collected and causes them to cough. So you want to make sure that they're elevated, that if you can give them some steam prior to sleep, you make sure they blow out their nose. And if they require any medications, definitely check with your pediatrician on what's required.
Doc, next question. There are lots of questions. I know you answer patiently. Continue doing that. If you can't touch the Facebook questions, I would request you if you could just a very important and different kind of question. As parents, also handling kids would be very stressful. And one of the questions which came is that how to indulge in sexual intercourse when kids are always at home. So how do you, as parents, also take your time out and have some private time?
Yeah. So I know this is a topic that a lot of us don't discuss. So I'm glad somebody had the courage to go ahead and bring it up. You still need to have your intimacy with your partner whenever you possibly can. So when the kids are around, I know a lot of our cultural factors are where we co-sleep with our kids. Make sure you go ahead and have that private space where you and your spouse can be. And you'll have to go ahead and avail of that time where you can get that intimacy and go ahead and do it. It would be as if any other time. It's if your child was on vacation, how would you go ahead and do it? You would go ahead and take out that time, not during the day when the kid is around, but when the kid is asleep, you can definitely go ahead and partake in that intimacy.
How far would it be safe sending kids to school after the lockdown?
Actually, let me just go back. Just a thought. On that question. I'm not sure if the question was because of social distancing issues or if it was because of that the kids are around.
I think it's more of the kids around. So if they're not on the schedule, they don't get any private time. So I think it's very important to put them in a schedule where you get your own time, right?
Right. So that's why it's important to make sure that the kids get to sleep on time when they need to get to sleep. So I just wanted to make sure I answered that question. So please go ahead. What was the next one?
How far is it safe sending kids to school after the lockdown?
So that's a question that I don't think anybody has an answer to, and we would go ahead and see how it rolls out. And I know in the US, we are opening up the community in phases so that we're rolling it out slowly. we don't know how the virus is going to be circulating at that time and how the transmission is going to happen or what the caseload will be. All we have is what we have seen in China and other countries where they have released the lockdown. And I think the numbers in China are small, but they are still there. So, and there's different theories about how the virus may be in different parts of the world and different temperatures and different climates. So there are theories that as the summer comes around, the virus might die down. There's theories that the virus might mutate and may not be as harmful. So we'll have to see. We'll still have to be very careful with our kids. We'll still have to make sure that we are in direct contact with our pediatrician so that any doubts that you have, you will bring it up to them and make sure that they're able to answer them for you. So stay protected with a mask when you go out. Make sure you keep your social distancing wherever you can. Make sure you go ahead and do good hygiene and hand washing. And I think that is going to be the norm for a while. So make sure you go ahead and teach your kids that is what they need to do.
Thanks, Doc. I'm not going through this thing. I think this is a very important question. Me and my wife also had a discussion on this. There's a talk of in the city that HCQS is a measure for coronavirus. How safe is it to take it? And 50 mg suspension from IPCA labs, I have bought to be safe. What are the precautions for this? I'm not sure about the second question, but the first question on HCQS, hydrochloric.
So once again, it has not become the mainstay of treatment right now because the research is still not validated and not finalized. I know it's being used differently in different parts of the world. So in the US, we're using it for severe cases. In India, I think I've heard a lot of people are using it as prophylaxis. I wouldn't use it unless you were directed by your pediatrician to give it for some reason. And in kids, there is no recommendation to use it prophylactically. So I would not go ahead and use it in our kids. I'm sure as you've been hearing about hydrochlorothiazide, the hydroxychloroquine, you must have also heard about how it can impact your heart and deaths from people who have taken it, who shouldn't have taken it. So I would not recommend it just to take it randomly, but to take it under medical supervision.
Great. I got the same advice from my doctor. Thank you so much. The next is, I think Cortana and COVID-19 are two types of virus. Is there already two strings of viruses which are there, and any knowledge of the same?
I'm not sure of that. I mean, there are a lot of different coronaviruses out there, and especially that we've seen in epidemics in the past that are family members of COVID-19. So I'm not sure what exactly they're looking for, but there are many different types of coronaviruses out there.
Okay. One way, milk with turmeric every night, is that a good immunity booster?
So I think Ayurveda
turmeric
and a bunch of
haldi.
Yeah. I think yeah. Can you hear me? Can you hear me? Can you hear me?
Yeah, I can hear you now. Good.
Okay.
I can hear you.
Okay. So
yes.
So the thing. Okay. So there's no harm to it. I think there are Ayurveda and a bunch of other research that's out there shows that it may help. So if your child is willing to take it, definitely go ahead and take it. So my philosophy is, if a child can go ahead and take that's not going to cause a harm and it's a natural product, definitely go ahead and take it.
Okay. A very good question. Is playing with pets, cats and dogs, safe?
Sure it is. I think right now there is, we don't know about any sort of transmission that's happening with domestic pets that you have at home. So you should be okay to play with the dogs.
And it should be emotionally very good for the kid also. So good.
Of course.
Yeah. There's another question. Chandana Sharma asks, children usually stick with what they like, especially with TV, laptop, etc. How to cope up with this sedentary behavior during lockdown?
So I know a lot of people are offering physical activity classes, dance classes. I know our center at GK2MWC also has offered dance classes to kids on Zoom. try to get them involved into that and get them to have that physical activity time. So if during your regular school day, you would have come back and you would have rested and then you would have had an hour of physical activity outside, you can go ahead and do that internally in your house with any sort of activity that they may want. So this is a way that you can use media constructively for the child's benefit. And this is something that the whole family can do together. It doesn't have to be that, hey, bacha, you go there and do the dance class while I'm sitting here and enjoying myself. So you have to model a behavior, and the child, if they see the parents doing it, they'll probably end up doing it as well.
And it helps to move to Ashana kid-centric homes too. So, but
of course,
lots of activities happening with all of us. Just truly follow My Whole Child or Facebook, Ashana Facebook, and you'll see a lot of programming happening. And it's generally between 4 to 6. So it allows right after school for kids to do some programming after that.
Right, and it's been great. I think it's a great outlet for the kids as well. So thanks for whatever you're doing for all the kids out there at Ashana.
This is a long question. So I think it's again the HCQS. What are precautions with respect to this suspension? I just bought as hospital is far away. Not sure if that question I'm not able to understand.
So I think I sort of understand. If you've bought it, just keep it on the shelf. Don't use it. That's the only precaution you need to take right now. If your child ever needs to take it, which I have not seen a case yet, I would just go ahead and figure that out at that point. One thing also just to add at this point, because I know that we are going to be running out of time shortly, is if they have any questions, they should go ahead and email or send something out, and we'll try to answer them as much as we possibly can.
Thanks so much, Doc. It's always great. And I told at the beginning, you have lots of patience, and the way you answer is great. So please keep your questions pouring, and we'll figure out a time to answer it, hopefully soon enough. There's another interesting, so somebody is getting teletherapy, but the kid is not ready to stay on it. How can we get them interested in teletherapy?
It's going to be a challenge. I think a lot of kids don't have that attention span, and they need that human interaction. But once again, if you can provide that structured environment for them, tell them that, okay, this is a space, you cordon off a room area in your house and say, okay, this is the therapy center for you. You're going to come in here, you set it up as if they were going to a center. You go ahead and put the screen in and tell them this is the therapy space at this point, and they try to follow it. That may work, it may not work. It can also, the kid will, not be able to sit for a few minutes. And then after that, go back in again and try again. And really that's it, I think. And if you're running into much more challenges, talk to the therapist to see how and what might work.
Fantastic. This is a personal question. In spite of giving fiber food for my 5-year-old, he still suffers from constipation. What else can we do to improve his constipation?
So there are different fiber supplements that can be tried. Definitely increasing the roughage, the fiber, the green vegetables, having more liquids, drinking more water. These are things that will help. And definitely physical activity, especially if the kids are going to be sedentary. A lot of times their bodies are not moving properly and they may suffer more constipation. So make sure that they're eating fruits and vegetables, make sure they're drinking lots of fluids, and make sure they're physically active. And then if on top of it, you need supplements, that's something that I'll defer to their pediatrician to grade the supplements as needed.
We'll take the last couple of questions, then you can sum it up for us. There's still lots of questions there on the same thing. One is eating eggs safe at this point of time?
Sure, there's nothing that's been documented for transmission of corona from eggs.
So somebody has a 3-year-old who is not clearly able to speak. What should he be doing?
He should get an evaluation done right away, because a 3-year-old should be saying, should be having a conversation. So that child has speech delay and needs to be evaluated by a therapy center. They can definitely call our center at MWC at GK2 and get an evaluation done.
I would strongly suggest that. And MWC right now is giving teletherapy, so they can start helping you right now. Last question I'll take, and then we'll, if you could sum it up, and then we can spend some time. If you could spend some time, me spending time won't be helpful. If you could spend some time answering on Facebook, and we'll push some of these questions to Facebook for you to answer. All right. So the last question is how to make sure my 4-year-old daughter is not gloomy and dull as we're getting day by day by being shut. You've kind of answered that, so I'll not take that up. This is a different kind of a question. So if the kids wake up many times in the night to drink water, we're still on fans and didn't start ACs. So what's the major reason for it and what measures to be taken?
So this needs to be investigated further. Is there an issue? Why is the child drinking so much? Is the child also urinating in addition? Because these could be the signs of something else going a little bit more serious than just the kid waking up a few times to drink water. So I think it needs to be discussed a little bit more in detail.
Great. If you could sum up the thoughts you have, and thank you.
So it's great to talk to all of you guys, and thanks Ashiana for hosting this. I think this is a challenging time for everybody. I think there's a lot of people who've lost many friends and family. It's a serious time. We need to make sure how we can play our part to stop the spread of the virus. And the rules and regulations that are being laid out by the authorities are not there just because for the sake of doing it. It is because they have a value. Please do follow those rules and regulations. Do not challenge the authorities at this point for why are you making us stay home? Why are you making us have a lockdown and so on? Work with everybody as much as you possibly can. Try to help your frontline healthcare workers as much as you can. There are a lot of people who are not able to get some food. There are a lot of people that cannot get PPEs at this point. Please, whatever you can do in your community to do some fundraisers, to go ahead and do some donations for the people that are really in need and that are out there to protect each one of us. This gloomy phase will, I am sure and I'm hopeful, will pass soon, and we hope that we'll normalize everything as quickly as possible and everybody can be happy in their Ashiana.
Thank you so much, Dr. Mehrotra. Thank you for spending the time. And I know your time is very expensive. And again, you didn't disappoint me. At least you were as clear about your answers without using jargons, which I talked about. I would like to thank the team who've brought this together, both from My Whole Child and Ashiana. Really appreciate it. I hope you guys enjoyed it. If you guys liked it, please share on Facebook this video so more and more people can get this knowledge. I think this question is something which a lot of people are going through and not getting answers for, and it's very difficult. And thank you, Dr. Mehrotra, for doing the same.
Thanks, and thanks to the entire technical team that's been working day in, day out. I don't know all of them, but they've been working diligently to bring this together to all of you. So thanks a lot. And hopefully our kids will be happy and healthy and so on. Thank you.